Low blood pressure, also known as hypotension, occurs when blood pressure levels fall below the normal range, causing inadequate blood flow to vital organs. While high blood pressure often receives more attention, low blood pressure can also have significant health implications. This comprehensive guide aims to provide valuable insights into low blood pressure, including its causes, complications, and various treatment options, both pharmacological and non-pharmacological. What is low blood pressure? Blood pressure is the force exerted by circulating blood against the walls of blood vessels. It is typically measured in millimeters of mercury, mmHg, and expressed as two numbers: systolic pressure, the top number, which represents the pressure when the heart contracts, and diastolic pressure, the bottom number, which represents the pressure when the heart relaxes between beats. Low blood pressure is generally defined as a reading of 90/60 mmHg or lower. Most of us are familiar with the concept of high blood pressure, but what about low blood pressure, also known as hypotension? Hypotension is generally defined as a blood pressure reading of 90/60 millimeters of mercury or lower. While it might seem like having lower blood pressure would be healthier, the reality is that hypotension can lead to inadequate blood flow to your vital organs, causing significant health risks. Understanding the causes of low blood pressure can help you manage or prevent it. There are various factors that can cause low blood pressure. Let's delve into some of the major causes to better understand this condition. First off, dehydration. This can result from excessive sweating, vomiting, diarrhea, or simply not consuming enough fluids. When the body is deprived of water, blood volume can decrease, leading to a drop in blood pressure. Next up, medications. Some of these, like diuretics, alpha blockers, and beta blockers, can indeed lower blood pressure as a side effect. Even certain antidepressants might play a part in dropping your blood pressure. Heart problems, too, can be a culprit. Conditions such as heart attack, heart failure, or heart valve disorders can prevent the heart from pumping blood effectively, resulting in low blood pressure. The same goes for bradycardia, which is when the heart rate is slower than normal. Endocrine disorders can also lead to low blood pressure. Conditions affecting the adrenal glands, like Addison's disease, thyroid disorders like hypothyroidism, or issues with the pituitary gland can all disrupt hormone levels, affecting how blood pressure is regulated. Pregnancy is another cause. Especially during the first and second trimesters, hormonal changes and the expansion of blood vessels can lead to lower blood pressure. Nutritional deficiencies are another factor to consider. If your body is lacking essential nutrients like vitamins B12 and folate, it could contribute to lower blood pressure. Lastly, certain neurological conditions can affect blood pressure. Disorders like Parkinson's disease or autonomic neuropathy can disrupt the autonomic nervous system's regulation of blood pressure, leading to lower levels. So, as you can see, low blood pressure can result from a variety of causes. It's a complex condition with many contributing factors. But by understanding these causes, we can better identify potential risks and implement preventive measures. Awareness is the first step in maintaining healthy blood pressure levels and overall good health. While low blood pressure may not always be a cause for concern, it can lead to complications. This is particularly true if it results in an insufficient supply of blood to the body's vital organs. Let's delve into some of these potential complications. Firstly, we have fainting or syncope. This is a sudden temporary loss of consciousness that usually occurs when blood pressure drops suddenly, reducing blood flow to the brain. It's not uncommon for individuals with low blood pressure to experience a fainting episode, particularly when they stand up too quickly or exert themselves. The next complication is dizziness or lightheadedness. This is often one of the first signs of low blood pressure. Similar to fainting, it can occur when you stand up too quickly, as blood pressure drops and less blood reaches the brain. This condition, known as orthostatic or postural hypotension, can make you feel unsteady on your feet or as if you might pass out. Another common symptom of low blood pressure is fatigue. This pervasive tiredness can make it difficult to perform daily activities and can significantly impact your quality of life. The fatigue results from inadequate blood flow to tissues and organs throughout the body, depriving them of the oxygen and nutrients they need to function optimally. Low blood pressure can also result in blurred vision, a rapid or irregular heartbeat, and even depression in some cases. These symptoms can significantly impact a person's daily life and overall well-being. In severe cases, low blood pressure can lead to shock, a life-threatening condition that requires immediate medical attention. In shock, blood pressure drops so low that the body's organs do not receive enough blood, leading to their failure. It's important to remember that while these complications can be concerning, they're not inevitable. Many people with low blood pressure lead perfectly healthy lives. However, if you're experiencing symptoms like those we've discussed, it's crucial to seek medical advice. Please subscribe to our YouTube channel for access to precise information. Thank you. Recognizing these complications early can lead to prompt treatment and prevention of further health issues. So keep an eye on your blood pressure, listen to your body, and don't hesitate to seek professional medical advice when necessary. Fortunately, there are various treatment options for low blood pressure. Both pharmacological and non-pharmacological strategies can be employed to effectively manage hypertension, and it's crucial to remember that individual treatment plans should be personalized, taking into account the specific causes and symptoms of each individual's condition. Pharmacological treatments involve medications that work in different ways to increase blood pressure. It's very important to note that medications should always be used under the guidance of a healthcare professional, as they can have side effects and may not be suitable for everyone. Always consult your doctor before starting any medication. Non-pharmacological treatments, on the other hand, usually involve lifestyle modifications. Regular physical activity, for instance, can help improve circulation and increase blood pressure. It's also essential to stay hydrated and maintain a healthy diet. Consuming small, frequent meals rather than large ones can prevent a drop in blood pressure that can occur after eating. Additionally, limiting alcohol intake and avoiding prolonged exposure to hot water, such as long baths or showers, can also help prevent low blood pressure. If you experience orthostatic hypotension, which is a form of low blood pressure that occurs when you stand up, using compression stockings or elevating the head of your bed may also be beneficial. While these strategies can be helpful, it's also important to address any underlying conditions that may be causing low blood pressure. For example, if a certain medication is causing your blood pressure to drop, your doctor may need to adjust the dosage or switch you to a different medication. Similarly, if a heart condition or endocrine disorder is at the root of the problem, treating that condition may help resolve the low blood pressure. Remember, knowledge about low blood pressure and its management can help maintain good health. Always work closely with your healthcare provider to develop a treatment plan that's right for you. In this video, we've learned about low blood pressure and its implications. We've delved into the causes, ranging from dehydration and medications to heart problems and endocrine disorders. We've considered the complications, including fainting, dizziness, and fatigue. And we've explored various treatment options, both pharmacological and non-pharmacological. To maintain healthy blood pressure, it is essential to adopt a balanced diet, stay hydrated, manage stress, exercise regularly, reduce sodium intake, maintain a healthy weight, attend regular health checkups, and limit alcohol and smoking. Please subscribe to our YouTube channel for access to precise information. Thank you.